Have you ever really thought about what goes on behind those big, heavy, lead-lined doors in a hospital? Today, we're pulling back the curtain on the secret rules of the radiology department. It's one of the most high-tech and, frankly, most regulated places you'll ever find.
You know, we've all been there. You're in that paper gown, maybe holding your breath for an x-ray. It seems simple enough, right? But what you don't see is this incredible, intricate system of rules working behind the scenes to make sure that one image is not just perfect, but more importantly, totally safe. And the key to this whole hidden world? It's all laid out in one single document, the Radiology Policy Manual. Honestly, you should think of it as the ultimate rulebook. It dictates every single move, from the moment you check in at the front desk to the second that final report is written. So, let's do it. Let's crack open this blueprint and see exactly how it builds this fortress of safety and precision around every single patient who walks through those doors. But of course, this system isn't run by robots, so let's meet the highly skilled team that actually brings this entire blueprint to life. Right on the front lines, you've got the technologist. This is the expert who gets you positioned just right and operates these incredibly powerful machines. And then there's the junior resident. They're a super sharp doctor in training who takes the very first look at your images, always, and I mean always, with a seasoned expert guiding their analysis. But that team goes so much deeper. This chain of command makes sure everyone is accountable for their part. But look closely at that line for the Radiation Safety Officer, the RSO. See how they report not just up the chain to the head of the department, but also to outside regulatory bodies? That is a brilliant safety feature. It gives them total independence to put safety above everything else. So the Radiation Safety Officer, or RSO, is basically the department's guardian of safety. They're the ones monitoring staff radiation levels with special badges, making sure every single piece of equipment is perfectly shielded. Their authority is independent, which means safety always comes first. No exceptions. Okay, so how does this all actually come together for a patient? Let's follow a hypothetical patient, we'll call them Alex, on their journey through a CT scan. We're going to see this incredible system in action. From the very moment Alex arrives, their entire path is carefully, meticulously mapped out in these 6 stages. The rulebook, it leaves nothing to chance. Let's zoom in on a few of the most critical steps, shall we? The first, and honestly the single most important rule in this entire system, it all comes down to the number 2. This simple number is the absolute bedrock of patient safety in the entire hospital. So, why is this such a huge deal? Because using 2 separate identifiers, like asking for your name and your birth date, is a fortress against one of the most terrifying medical errors possible, treating the wrong patient. This simple 2-step rule is a non-negotiable shield. But what if Alex is in a real life-or-death situation? Well, the system has a kind of emergency override, and it's called STAT. This one word triggers a race against the clock. For something like a stroke or a major injury, that CT scan has to happen within 30 minutes. It's a fast track to a potentially life-saving diagnosis. Oh, and you better believe this rulebook is obsessed with cleanliness. For most patients, it's about standard stuff: gloves, hand hygiene, wiping down the table. But if there's a risk of a highly infectious disease, whoa, the protocol shifts into high gear. We're talking N95 masks, a dedicated time slot for the scan, and then a deep top-to-bottom cleaning of the entire room. And this, right here, perfectly illustrates all those layers of safety we've been talking about. Let's say Alex's CT scan needs contrast dye. Well, that triggers this mandatory checklist. They'll check kidney function with a simple blood test, that's the EGFR, to make sure Alex's body can clear the dye safely. They review their entire allergy history, and they have a fully stocked emergency cart ready to go, just in case. This is proactive safety at its absolute best. Of course, none of this is even possible without the amazing technology. But how in the world do you keep these multi-million-dollar machines in perfect working order 24 hours a day, 7 days a week? Well, the answer is just relentless quality control. Every single machine has a strict schedule of checks and tests. We're talking everything from daily warm-ups to these really deep dives with a physicist. It is a non-stop effort to guarantee a perfect image every single time. And what happens if a machine actually goes down? Well, there's a strict, time-sensitive plan for that too. The problem is logged instantly. The tech team is on it within the hour, and the manufacturer gets the call within 4.
But here's the most important part. Even after it's fixed, that machine stays offline until the RSO and a senior doctor personally give it the all clear.
This whole system is backed up by a crystal clear chain of command for problems. A technologist sees a glitch, it goes straight to the expert. A resident spots a safety issue, it goes right to the very top. It's a safety net that's designed to catch problems before they can ever grow.
All right, so we've met the team, we've walked the patient path, and we've checked the machines. Now for the most important part of all. How does all of this work get a life-saving diagnosis to your doctor and get it there fast? You guessed it, the rulebook even dictates the speed of information. A routine scan for an outpatient, they'll have a report in 24 hours. A stat case like Alex's, 3 to 6 hours. An ER emergency, the doctor gets those results instantly, sometimes even before the patient is off the table. It's a system designed for one thing, getting answers fast. And when you really think about it, that's what this is all about. The two identifiers that protected Alex, that stat protocol that sped up the scan, the QC checks that guaranteed the machine was perfect, they aren't just red tape. They are a web of protection, a system of checks and balances built from years of experience, all for one purpose, to deliver the clearest possible picture of what's happening inside your body, safely and reliably. So the next time you see a medical image, maybe you'll see more than just shades of gray. Maybe you'll see the invisible system, that dedicated team, and the incredible technology that all worked together to turn a little bit of physics into a chance to heal.